So let's move on to our third speaker, Ella August. She is a faculty member in the University of Michigan School of Public Health and the editor-in-chief of PREPSS, Pre-Publication Support Service. PREPSS supports researchers across the globe in publishing their work in peer-reviewed journals and aims to address authorship disparities in academia. Dr. August's research investigates how to teach writing effectively in public health and also seeks to better understand how to strengthen capacity for research publications. Today, Ella will talk to us about decolonizing publications and PREPSS initiative. It's all yours, Ella.
Thank you so much for that lovely introduction. So hopefully, let's see, I'm just going to try to share my screen here. Now, can you see my slides? I don't see that little yellow. You can see just the slides. Okay, fantastic. Thank you. So hi, everyone. Thank you to the Decolonizing Global Health Student Working Group for inviting me to be a part of this conference and this panel. I want to also thank Miriam and Christian for their amazing talks and for so thoughtfully setting the stage for us today and for their compelling presentations. I'm Ella August, as Eileen mentioned, and in addition to being an assistant professor in the School of Public Health at the University of Michigan, I'm the editor-in-chief of Pre-Publication Support Service, also known as PREPSS. My talk is entitled Making Global Health More Equitable, and I'm going to talk about our professional activities today at PREPSS in this talk, which do very much relate to education and training in a global health context, but not in a classroom. So maybe a good way of thinking about my talk is as a case study that attempts to sort of apply some of the philosophies and values that we just saw in Miriam and Christian's talk. So I would also love to get your feedback, maybe during the interactive phase of this presentation, on our activities as we do wrestle to live up to our stated mission and to embody these values and goals that we just heard about in these previous talks. I'll start by briefly sharing that we don't actually use the word decolonize at PREPSS. We don't really label our activities, though they do overlap quite a bit with the decolonize movement, and that is why I was excited to come and share what we do and to hear and learn from all of you today. So this is a brief overview of my talk. I'm going to start by very briefly mentioning some key barriers and issues that gave rise to the birth of our organization, PREPSS. And then I'll give you an overview of what we're up to at PREPSS, our mission and our activities. And then, although all of our activities are actually educational in nature and global health focused, I'll focus the rest of my talk on one component that probably is the most relevant to this group, our peer reviewer training and program. So the need, as I know that you are all aware, for greater capacity and writing and publishing skills in an academic context and low resource settings is really dire. First, of course, we all know about the enormous importance of publications as they represent the culmination of a long chain of research activities. And of course, without them, the entire research investment, the entire investment in the research is really wasted. There's also a great disparity in authorship between high-income countries and low and middle-income countries. Authors from high-income countries in so-called collaborative research tend to dominate the author lists of publications describing research in low and middle-income countries in the global south. And then even when local authors are included on the author list, they're underrepresented in the important first and last author positions. So these are these bottom two publications are two reviews, of which there are many, showing the disparity in this area. We are a nonprofit organization, and our primary mission is to strengthen or to support research capacity To accomplish this, we train authors on writing and publishing their research findings in academic journals. And that is what the three programs at the top of the tree are: the Research Partners Program, our Journal Partners Program, and our Research Training Program. I don't have time to go into all of that today. But these three, programs in the branches of the tree help us support authors in publishing their research in academic journals. We also coach and mentor educators on how to conduct these author trainings, and these are our Train the Trainers program. You can see that is shown in the roots of the tree. And so I think I'm a little bit behind here in my animations, but the Train the Trainers program helps us support local educators and leaders in training their own local researchers. And I think that Miriam mentioned in her talk that the goal of global public health should be to make ourselves obsolete, those who are working in this space. And that is the focus of our Train the Trainers activities, to shift power to the local regions where we have been working. Our third main activity is the one I'll be focusing on mostly in this rest of this talk, and that is our peer reviewer training workshops. And so the focus of these trainings is to train researchers on producing a high quality peer review. And these trainings also support our main mission of capacity strengthening for research. It also helps us to recruit trained volunteers to our organization, and I'll say more about this and really explain the whole program in a moment. So we are a nonprofit, and we are funded entirely by our clients. I'll just give you a few examples of our clients. Center for International Reproductive Health Training. There are two headquarters to this organization. One is at the University of Michigan, where I work, and one is in Ethiopia right now, moving to Rwanda. And so the focus of this organization is sexual and reproductive health and rights. And they have a training program where they train researchers, mostly clinical, OB-GYNs, doctors, nurses, and midwives on conducting research. So they're actually bringing their clinical skills to the research realm. Another client is out of Addis Ababa in Ethiopia. They are consultancy, and what we're working with them right now on is some health research they've done on health extension workers across Ethiopia. And another client that we have is a client focused on mathematical and simulation modeling to prevent tobacco use. We took them on as a client, even though they are located in a high-income country, because they, one of their stated goals is to reach out and recruit students from disadvantaged backgrounds to the field of modeling, to provide them extra support in transitioning and to learn this work. And I could say more about that later if you're interested. This is an overview of our core service package. We typically start with a pre-workshop webinar, and then we do, these have traditionally always been on site, now they're on Zoom. We do a 3-day workshop, hands-on. The authors bring a draft of their manuscripts. They work on it during the workshop, and then after the workshop, the participants continue to work on their papers, and then when they're ready, they submit it to us at PREPSS. And we provide, we have 2 peer reviewers that provide up to 3 rounds of peer review for these authors. And then when the author is happy with it, then it goes to copy editing, and they get up to 3 rounds of copy editing from a professional copy editor. These are 2 examples of some of the papers that we have been published with our support. These are both out of Ethiopia, both authors, on family planning and sexually transmitted diseases. Now I'm going to just kind of give you an overview of our peer reviewer training workshops. And the goal of these workshops is to support participants in improving their peer review skills with a particular emphasis on cross-cultural communication. We also discuss in these trainings global health disparities to make sure that everyone understands the context in which our activities take place and the motivation behind our activities. The workshops are free and they help participants strengthen their peer review skills and support their professional development, provide networking opportunities. We do ask participants to join the PREPPS peer review team as a volunteer after the training, and we're clear about this expectation from the start. The commitment is to review 1 to 2 papers per year, and the peer review sort of, this activity is a standard service activity for academic faculty that counts toward our own advancement and career development. So once participants join, they continue to learn and grow. After a peer reviewer completes a review, they get access to the other person's review. Because each author gets 2 peer reviews. And so this provides an opportunity for them to maybe, see points that they may have overlooked and just get a different perspective on the paper that they reviewed. So most people that go through our trainings are PhD candidates, postdocs, research fellows, medical residents, and we also always have some faculty that join as well. And then we do require that participants have at least 1 first authored publication in a peer-reviewed journal to join these trainings. This is, just to kind of give you an overview of what the trainings entail. We talk about the need and the disparities that currently exist in publishing. The power imbalances, we give an overview of PREPPS. We have participants who are going through the training to do a practice review and to come prepared with that. And then they work with a partner in the main workshop training to improve that review, and then they get feedback on that review from the group. We talk about respectful and supportive communication. We also talk about, the kind of the mechanics and logistics of providing a peer review as well. These are participants from our most recent peer reviewer training. We did our first Zoom training in October. We do the trainings twice a year. I think we've all heard stories about, unexpected positive outcomes from COVID. And for us, this was one of them. We've always held these trainings in person before. And, we were always wanting to improve our diversity in our peer reviewer, team. And for this particular training, we had people sign up from 10 countries, which was totally amazing. And these are a few of the people that agreed to have their pictures shared. So we are committed to building a global community of volunteer peer reviewers at PREPPS. To date, we have peer reviewers from 21 countries. I want to make sure I specifically mention how we are participating in Decolonize activities at PREPPS and with our peer reviewer training specifically. And 2 areas I'm going to touch on include adjusting power balances and also structures. So in terms of addressing power balances or imbalances, the first thing is I want to highlight is that our policy that peer reviewers and none of the PREPPS staff or anyone associated with PREPPS ever participates as authors on the manuscripts we support. We're squarely in a supportive role, and so that the power and recognition remains with those who did the work, who know the research, and who deserve the credit. We see our work as supporting researchers in publishing to enhance their careers, and with the ability, to successfully publish can come, grant funding and promotion, and the combination of the 3, publications, grant funding, and new research, comes the ability to, modify policy and to help set research priorities in their local, in a researcher's local region. We train trainers, supporting the regions to take over their own training and again, shift the power. I guess I didn't put a bullet in for this, but I want to acknowledge that we're a white-led organization, and I recognize that this is an issue with respect to power balance. We regularly hold discussions around these similar kinds of topics, to think about how we can better live up to our stated values and mission. At our retreat a few weeks ago, we had, discussed setting up a diverse advisory board to provide guidance on our policies and initiatives. And we're still thinking through how to accomplish this and brainstorming other ideas that may help us be more balanced in terms of power. One thing we are very proud of is the diversity in our peer reviewer team, which we have been working on. Since we started, we're a fairly new organization. We started in 2017. So we're not a static organization. We're still developing our identity and our constant revisit our policies to try to really be our best selves. So in terms of structures, there are two main structures that we see ourselves working within. It's not totally clear to us how we can be working, as a team of, our core team is 3 part-time people at this point. So we're a small organization, but, we do give a lot of thought to these kinds of issues. We're thinking about how we can make, work to change and break down some of these structures. So the first one is the publishing industry, and Christian set this up nicely and talked about this, and this is an issue for sure. And the one part of it is that big publishing is just dominates and is just making so much money off the backs of academics across the world. And the other issue has to do with the fact that the big journals, or many of the big journals, are English language international journals, and that is a very long conversation. But it's true that we work within the structure of big publishing, because what we do, first of all, let me say that we support authors wherever they want to publish. We will help them. We have no opinion. We have no opinion on where authors want to publish. We don't encourage them to publish in international journals. We want to support them wherever they want to publish. However, it's true that, our team, we don't have a lot of bandwidth. We don't have a lot of languages that we speak and can support people who want to publish in Swahili or some local language. So that limits us in how much we can really that limits us to working within the structure of publishing and specifically within international journals. And that's a limitation of what we do. So the other institutional structures we work within are educational institutions. So educational institutional structures require publications for advancement, for promotion. And in most of these institutions, many of them emphasize international English language journals as desirable. So again, it's not clear to us how to address this structure within our activities, especially, as I said, given the size of our organization and this versus the scale of this problem. But it is something for us to think about and to take seriously, and would love to hear your thoughts as well. So I don't want to, spend too much more time. I just wanted to, show our website for those of you who are interested in learning more about our organization. We published a practice paper in BMJ Global Health a while back. A link to that is shown here, but it's also on our website. And that's it. And I think the questions will probably come at the end, right?